Good morning, guys. I hope we're all sparkly. In the last video, we spoke about the need to balance your cortisol, noradrenaline and adrenaline against your testosterone, estrogen and DHT. And how really the most important hormone of them all is cortisol, because it's going to keep you alive. And what's it all about? Survival. Is it about survival? Yes. However, our higher state of consciousness has given us the opportunity to seek more. What is that? Purpose and meaning. We are seeking purpose and meaning. No, we're not. We're seeking happiness and contentment. How do you attain happiness and contentment? By having purpose and meaning. So, stress. I've said it before and I'll say it again. We are physical beings in a world full of psychological stress. And our hormones don't know the difference between psychological stress and physical stress. And guess what? We're not very good at coping with psychological stress. Why? Because we do not understand our physiology. We do not understand the negative impact of our behaviors on our physiology. And what happens when our physiology is dysregulated? You guessed it, dysregulation. And when it comes to testosterone, we're talking about testosterone deficiency and the associated negative symptoms such as lethargy, low mood, brain fog, low libido, and the physical things: erectile dysfunction, loss of lean muscle mass, increased visceral fat, weakening of your bones, cardiovascular deterioration. The list goes on. So what should we be doing? We should be understanding our physiology and doing what? Hunting and gathering. That's what we should be doing. Our bodies don't care about work. They don't care about keeping up with the Joneses. Your male androgen levels follow a diurnal pattern for a reason. Every day is a new opportunity. So seize that opportunity by understanding your physiology. So stress, noradrenaline, adrenaline, cortisol, it is flying through your body to keep you alive. We exaggerate this through manifesting artificial nonsense. But you can't really avoid the artificial nonsense. So what should you do? You should understand it, hopefully resolve the negative things that are contributing to your excess stress, and also manipulate your parasympathetic nervous system. Now, we spoke about this briefly before. Your autonomic nervous system, sympathetic, parasympathetic. We spoke briefly about the polyvagal theory. Shall we go into it? Okay, this is something I say to my patients. What happens when a gazelle is in a lion's grasp? Nothing. It goes limp. Why does it go limp? It's essentially facing sudden death, or certain death, sorry. Now, why would you expend extra energy trying to escape when you are facing certain death? Because there's always the chance. There's always the opportunity. And now this is the lesson. There is always the opportunity to do what? Escape. Now, what would happen if that lion got distracted? What would happen if that lion gave that gazelle to its cubs and the cubs got distracted? It could escape. What happens when they come out of this state? They shake. So it's that reactivation of that sympathetic nervous system. The dorsal vagal part of the parasympathetic nervous system is there paradoxically to keep you alive. By doing what? Nothing. By you going limp. So, PTSD, these dissociative states, they're all actually as a result of activation of the dorsal vagal part of the nervous system and then the sympathetic overload that happens as a result of reactivation. How fascinating is it? Sympathetic versus parasympathetic. Catabolic versus anabolic. It really is amazing. But stress, it is real. Is it real? No, it's garbage. However, you can't escape it in a modern civilized world. I'm going to give you an example of a stressful day I had. It's not recently, because the stress that I have real now is in no way, shape or form the same sort of stress I had when I was working in the emergency department. Felix will agree with this. The level of stress might be perceived as the same, but if you actually take a step back, it's very different. And the proportional response should be what? Proportional. And what helps you achieve or sustain a proportional response? Healthy male androgen levels. Too low, you can't see the wood for the trees. Too high, you can't see the wood for the trees, because it's all about what? It's all about balance. So this particular night, working in a northern emergency department, 3 cases stuck out to me. 1, a cardiac arrest, no biggie. Happens all the time. The survival rate for cardiac arrests is not very good. Why does it compare with Norway negatively? Because the Norwegians are far healthier than us. So what are you going to look after? Your lifestyle, your diet, and your exercise. Be more Norwegian. Skål! So cardiac arrest, somebody died, no biggie, sorry, happens all the time. Go through the motions, follow the procedures, the protocols, but yeah, disappointingly, the survival rate is not very high for cardiac arrest, especially if you're older. That doesn't mean you don't try, and perhaps the most difficult part of a cardiac arrest is knowing when to stop. The second case was a guy that set himself alight. He attempted suicide by pouring petrol on him and putting a match to his skin. So he came in with 3rd-degree burns. He was still conscious, amazingly. It was horrible. Not the burns. Deal with the burns. He went off the burn unit. But it was horrible talking to him. Why? Because he felt a massive sense of remorse. And he said to me, "Don't bother with me, bother with somebody more deserving." Now that is a horrible thing to say and to hear. So obviously, I said, "You matter." And actually, I wouldn't want to be doing anything else other than dealing with you. So we are one consciousness, experiencing itself. Okay, yeah. So serious stuff. What was the third thing? Oh, I can't remember now. Some big trauma. Somebody got something chopped off or something. I can't remember. But it was a pretty heavy emotional night shift. I went home. What did I do? I felt dead. Absolutely dead inside. Because you can't have emotion when dealing with these situations. You have to be objective. You have to do what's in the best interests of the patient. And you have to remove your personal whatever. It's irrelevant. I don't agree with, I agree. Just shut up. Listen, do the job. And that's what it's about. So how did I cope with it? Well, I was an idiot. I caned a bottle of whiskey. I watched E.T. I thought I was dead inside. And I was reassured by the fact I cried at the part where E.T. was in the stream and he was all white. I actually said to myself, I remember this quite vividly, I'm actually human. I'm actually not this robot just going through life. Serious stuff. So, stress. Our coping mechanisms should not be caning a bottle of whiskey. They should be understanding our physiology, understanding that sometimes we need to seek help, understanding sometimes you don't need to draw the drawbridges up and isolate yourself. You don't need to listen to false prophets. What you need to do is take a deep breath, activate the parasympathetic nervous system, and reassess the situation. Often guys with low testosterone have this element of anxiety, low mood, and depersonalization. And our instincts say, seek the path of least resistance. It's inbuilt in us. It's inbuilt. Well, that sounds like the easiest solution. I'm going to miss these steps to get my reward. And if you've listened to any of our videos, what do you need to do? Earn your reward. This is the fundamental key to success. This is the fundamental key to sustainability. This is the thing that we lack in our society. What's it all about? Balance and stability.